Welcome back to the We Care podcast. I'm Jordan Vaughn, nurse practitioner.
And I'm Molly Cooey, nurse at We Care. On today's episode, we are tackling thyroid health and optimization. So if you've ever felt tired, cold, bloated, or moody, this one is for you. The thyroid is one of the most misunderstood parts of the endocrine system, and today we're going to try to break it down for you. So, Jordan, let's start with the basics.
So the thyroid is a tiny butterfly-shaped organ, and it is in our neck, and it is basically like the center for metabolism. It regulates our energy, our sleep. It regulates weight gain or weight loss, hair, skin, nails. There's so many things that, the thyroid it helps function. Think of your thyroid kind of like it's the metabolic gas tank, and you've got to put the gas in, to keep it going. That's your thyroid hormones.
Exactly. Now, what a lot of people don't realize is that you can have thyroid symptoms long before your labs are actually considered abnormal. So let's talk about those symptoms.
Okay.
What are the symptoms of hypothyroidism?
So hypothyroidism, that's the most common one that we see. Hypothyroidism is when people come in and they're like, I'm really tired. I have gained weight. My hands are cold. My feet are cold. They aren't sleeping well. They're just irregular periods. They're depressed. They're anxious. There's, all those symptoms go with hypothyroidism. And, me personally, I struggled with hypothyroidism, for years. And then I was on medication, for years, kind of bouncing around with medication. And then I had to have my thyroid removed due to, the small little tumor nodules that I had on my thyroid. And so after that, I'm in permanent hypothyroid state. If I am not on my medication, I am in a hypothyroid state. So I take Armour, and with that and with the hormone release from the Armour thyroid, it keeps me balanced where I'm not gaining weight. I still struggle with the cold hands, cold feet, those symptoms. Mm-hmm. So I do feel like that hypothyroidism, it is the most common type of thyroid disorder, and that's what I see most at We Care. And I can really relate to those patients as well.
So what do you think of as the most common symptoms of hyperthyroidism?
So hyper is not as common as the hypothyroidism. It's rapid heart rate. Anxiety is another one. Heat intolerance. So they usually are losing weight even despite like eating, and you just think of like really, really rapid heart rate, anxious and kind of shaky. Those are the type patients that you see that are hyperthyroid. And we actually, one of our estheticians, Lauren, she went through this state. She came into my office one day and she was like, my heart is racing. And she's like, look at my Apple Watch. And it was like 160. And all she was doing was facials. Like, she was doing nothing strenuous, nothing at all. And I'm like, that is not normal. I was like, let's, draw a blood panel and see what's going on. And I mean, I had a feeling it might be thyroid related, just some of the other symptoms she was having. She was kind of talking about mood and irritability and just very anxious and things like that. And when we got her labs back, she was definitely in that, hyperthyroid state. And then her TPO antibodies were just out the roof. So we got her in with an endocrinologist, and, they took care of her, which, we can do a lot of things here too. But there are times that we will refer out to endocrinology because they are the specialist.
Right. And it's tricky a lot of times for women, especially because they could bounce back or bounce between hyper and hypo depending on the hormone changes that are going on in the body.
Yes, postmenopausal or perimenopausal, postpartum, all of those women, we typically see them bouncing back and forth. And someone that's just dealing with a lot of stress, you can see them bounce back and forth as well.
Right. So I do think it's kind of important to point out here that a lot of those symptoms kind of go along with symptoms that we talked about during our hormone replacement segment. Yes. So this is why it's so important to get the correct labs to verify, is it the sex hormones? Is it the thyroid hormones? What is really causing your issue?
And I will say this boldly, a TSH is not going to be the only thing that you need to diagnose a thyroid disorder. And that is the main thing that people check is a TSH.
Right? Repeating, TSH is not the only panel that needs to be drawn. You are doing your patients a disservice.
Oh, so with that being said, when I'm drawing labs, I am drawing the TSH. I mean, that is one of the thyroid markers. It's just not the only one. We're drawing the thyroid hormones, T3. We're drawing T4, the free T3, free T4, and the TPO antibodies. So you want a full thyroid panel when you're trying to diagnose a thyroid disorder.
So bringing up the T3 and T4, can you tell me a little bit more about those?
Well, so our thyroid mostly makes T4, and that is, converted over to a T3. That is like the active hormones that are working on the metabolism in the body. So T4 is what you will see commonly. Some other providers, they'll check a T4 here and there, but they're not always checking the T3. And with the T3, sometimes your body is not converting that, T4 to T3 correctly. And that's where the issue lies. So if you don't look at those two hormones and you just look at the TSH, you're missing the whole picture. And I find a lot of times when the patients come in here, it's just the T3 that's low. And if you can stimulate that, T3 hormone, they are going to feel so much better, and it's going to return that, metabolic rate, and they're going to lose weight, and they're going to feel better, and they're going to stop losing their hair. So that's the difference between the T3 and the T4.
Right. So basically, if you're not converting well, your thyroid could still look normal on labs, but you still feel terrible.
Right. Okay. It's why most people say, my labs are normal, but I don't feel normal. Yeah.
So can you walk me through how you are optimizing thyroid care at WeCare?
So first thing, obviously, is the lab panel. I like for patients to come in for their labs before they see me. And a lot of people, that's different for them. They're used to going to the doctor and telling them all the symptoms and all the things, and then they just say, okay, well, we'll see you later, and then they get their labs done. So I like for patients to come in first, get their labs done. So once I see their labs, then I can bring them in for that consultation, and we can talk about what all symptoms are you having, which most of the time they've already filled out a symptom checklist, they've already filled out paperwork, so I kind of know what's going on before they come in there. But I bring them in, I go over the thyroid levels with them, and a lot of times I check a lot of other things as well. So if they have a thyroid imbalance, and let's say they're hypothyroid, I don't jump straight to medication. So sometimes if they're just on the borderline, we talk about diet, we talk about lifestyle factors, exercise. If they're doing all the things correctly and they still, are borderline, we talk about some supplements, some of the things, zinc, selenium, vitamin D. There's multiple things, iodine. We talk about those supplements first and maybe trying a more natural route. And if that doesn't seem to work and they're still borderline or hyper, then we would, talk about medication. And there's a few different medications as well.
What exactly are those medications that they have the options of being put on?
So you can go synthetic or you can go a little more natural. Synthetic is your levothyroxine or Synthroid, and that is really just working on T4, and it is a synthetic. Armor thyroid or NP thyroid, those are the more natural desiccated thyroid. It actually comes from pig thyroid. So you're actually giving the patient T3 and T4. So for me, that's my favorite. I like to go more natural route, and I like to give the patient the actual hormone that they're missing or not converting well. Those are the two big ones that I use here. There are other ones that you can use, but those are the two big ones that I use here, and I prefer to go the more natural route, and most of my patients do too. I'll say with the medications, I've had a lot of patients come in who are on levothyroxine, and they're still having those, same, my hair is falling out, I'm cold, I'm heat intolerant. they have all of those symptoms, or they've tried everything and they're still gaining weight. So those patients, sometimes just swapping them over to Armour changes everything.
It is nice knowing, though, that there are multiple options, to put somebody on. Just like if one isn't working well for you, you can swap to something else. It's always frustrating to me when there's a diagnosis out there and there's only one medication for it that's on the market right now. And it's just kind of like, hope this works for you. But if not, sorry about your luck.
Right.
So I have another question that a lot of people ask. Why does low thyroid make weight loss so hard?
Well, like I said, it is metabolism. So when you have low thyroid and your metabolism is not stimulated correctly, then you can do all the things right and you're still not going to lose weight. So once you address that and you're able to increase the patient's metabolism, at that point, when they do the right things, diet, exercise, they'll start losing weight.
You always do such a good job of explaining those things to me and to the patients, really well, to make it easy for us to understand.
Thank you.
So in past few episodes, we've done a couple of myth busters.
Yeah.
And so I'd like to continue that today.
Okay.
So myth number 1, if your TSH is normal, your thyroid is fine.
No. Just because you have a normal TSH does not mean that your thyroid is fine. And we do not treat numbers at We Care. We treat patients at We Care.
Yes. So myth number 2, thyroid problems always show up immediately on labs.
That's the biggest myth, because thyroid, it can take years for people to truly see a thyroid imbalance on their labs. And that is another reason why at We Care, we are not looking at your way on this end. We are looking at optimizing. And if you are on the low normal, we want to optimize that and get you on the other end of that range.
Yes, that's perfect. All right. Last myth, number 3, weight gain is just a lifestyle.
That is not true. You can eat perfect and still struggle. Sometimes it's not about, your diet and exercise, all the things. It's about your physiology and your thyroid, and it's not always just discipline.
Yes, thank you. I know that helped answer a lot of questions out there.
I'm happy to help always. If you're struggling, if you're having issues with weight, if you're having issues, if you're doing all the right things and you just can't seem to lose weight, or your cold hands or cold feet, or you're losing your hair, or any of those struggles, we would love to, get a panel on you. Or if you're not around here, go talk to your provider and make sure that they're listening and they're doing a deep dive on your thyroid hormones, your sex hormones, all the things.
Yes, if something feels off, advocate for a full workup.
I agree. And that's it for us. Join us next week. We are going to be talking all things IV therapy.
So make sure to subscribe, share this episode, and follow We Care Health and Wellness for educational content and behind the scenes content. And at the end of the day,
We care. Have a great day.